Good afternoon and welcome to another edition of Forever Young. I'm your host, David C. Linton, and welcome to season 2. In our last show, we had such a brisk discussion about the coronavirus and the pandemic and trying to nerve some myths and give you some information that you could really move forward in life with. And so we had a great guest in Dr. Anthony Jace, who's going to be here again to talk about some of the things that we talked about last week and to elaborate. One of the things that came out of last week's discussion was that the coronavirus has been around for a long time. And so we are going to kind of pick up that conversation where we left off. But before I can do that, I must, as always, I can't do this show by myself, and I'm glad that I don't. I'm always in the company of two lovely ladies. And of course, I have to introduce them, and that's my co-host, Miss Jean Hendricks. We call her beautiful. Good afternoon, Jean.
David, and I accept that adjective as being beautiful. Good afternoon. So I'm so happy to be back in your presence and the presence of Dr. Mitchell. Thank you.
That's right. And of course, the other part of that dynamic duo, I'm such a lucky guy to have these two beautiful women in my presence. I'm the only guy. And I'm going to talk to the producers and make sure we stay there. And that is Dr. Sharon Mitchell. She keeps us all together, and she's responsible for coming up with our topics and selecting our guests. And we're so fortunate to have her on the panel as well. Good afternoon, Dr. Mitchell.
Good afternoon, David. It is such a pleasure to be back with you again, along with Ms. Hendricks. I always look forward to our time together. So glad to be here again today.
And so, as I said in the opening, last week we started talking about the pandemic and everything that's been happening. Our guest, Dr. Anthony Jace, will be back on screen soon to talk about where we picked off. And when he comes back on, he'll give us a little bit more about his background, just for those of you who are just tuning in and missed part one. But, one of the things that we found out is that there's been some hesitancy because of, around taking the vaccines, because of the quickness in which they were made. But we found out that the work on these vaccines had been in the pipeline for years, because COVID isn't really a new virus. It's just this COVID-19 was new in the way it was more contagious. And so the foundation for the vaccinations was already in the pipeline. And I found that to be so amazing, because some people say that it happened too soon. And so it really did not happen too soon. It may have sped up just a little bit, but it was good to know that they did not start from scratch. And that's important for our viewers to know, that these vaccines have been in the making for a number of years. But enough for me talking. First of all, to get us started again, as always, and that's Miss Jean. I know she has something to share with us. So, Jean, you want to give us those pearl of wisdom as we get back to before we get back to Dr. Jace for part 2 of our discussion?
Yes, I do, David. And because so many people have fear in their heart as it relates to this vaccine, I've chosen a reading on fear. And it says, I must not fear. Fear is the mind killer. Fear is little death that begins totally from a liberation. I will face my fear. I will permit it to be passed over me and through me. And when it has gone past, I will turn the inner eye and see its path. Where the fear has gone, there will be nothing. Only I will remain. Back to you, David.
And that's right. We're coming here today to help eliminate some of that fear, because God did not give us a spirit of fear. And so I want to welcome back to the broadcast Dr. Anthony Jace, who's coming to us from Louisiana, and who has been practicing medicine for a number of years, a great background. I'll give him an opportunity to catch some of you up. So, Doc, for those who weren't with us last week, could you just give us a little synopsis of your background in terms of your medical practice, where you started, what you do, and then we'll pick up the conversation from last week. Welcome again.
Yes, sir. Once again, I want to thank you for inviting me. I'm Dr. Anthony Jace. I'm born and raised and still reside in New Orleans, Louisiana. Duly trained in the fields of internal medicine and physical medicine and rehabilitation. For the last 7 to 8 years, so I have a full consulting practice, and I'm also currently the director of the health ministry at my church, Mount Hermon Baptist Church, New Orleans, Louisiana, pastored by the Reverend Dr. John Jackson.
So, well, thank you for being here and agreeing to come back. We're going to get right back into our conversation because this part 2 is really all about the vaccine and vaccinations. And you talked about some of the things that we talked about, what vaccine hesitancy, those people in this, and why historically there's been some hesitancy. And you gave our audience some really good pearls of why we should not have the fears from yesteryear. Because for one, African Americans have been a part of this study and the creation of these vaccinations. Before, we were not a part. I always say we weren't, you want a seat at the table, but we weren't even in the room the last time. So in the room, but we were at the seat. So does the COVID-19 vaccination have any changes on people's DNA? We're going to talk about some of the myths we've been hearing about those things. And one of those things is that if I take that vaccine, it's going to change my DNA. What do you have to say about that, Doc?
Well, that's failure. But before I get into the DNA, I've learned over the years, my practice, that if you explain things to people in lay terms, they tend to receive your advice and recommendations more. So that being said, I would like to take this opportunity to try to give you a quick visual of how the vaccines actually work. Currently for COVID-19 specifically, there are 3 vaccines, and 2 of the vaccines are called messenger RNA vaccines. The other one is called viral vector vaccine. The Johnson, Pfizer and Moderna are 2 of the same types of vaccine. Now, if you would imagine your body, yourself, as a gated community, and where there's pretty much free traffic coming in and out. Even though you have a security, they pretty much let all the traffic in and out. What happens is with this virus, not only this virus, but all viruses, all infections, what happens is they come through the gate and the body doesn't recognize them as being bad. So what happens is once they get into your community, then the inhabitants of that car or that vehicle wreak all havoc community. They cause all they break in and they do whatever they do, all the bad things, which are the symptoms of the virus. Okay? Now, once that happens, now your body recognizes, if we see that car again, we have to know that it's a bad vehicle, and our security is going to stop it. Well, the problem is with COVID-19, you don't want to take a chance because it causes such severe problems. So what happens is with the Pfizer and the Moderna vaccines, they're called messenger RNA vaccines. Let's say an Uber, they come through the gate. All right. Now what they do is they go to the security office and they deliver a message. And that message is, look, if you see a vehicle with this hood ornament on it, that's a bad vehicle and that has bad people in it, bad things in it. So now that message is sent out to all security guards, which are antibodies. And all those security guards surround and go and they wait and they look for that hood ornament. So the next time the virus comes and they recognize that hood ornament, then security acts and they eradicate it, or they do whatever they need to do to subdue it. That's how the messenger RNA works. The vector actually is the messenger RNA riding in the actual car that the virus is in. So what they do is they take the shell that the virus is in and they take the virus out. They take all the bad out. They insert the messenger RNA. So now the bad vehicle comes up to the guard gate and goes in, and they bring the message directly to security, with our office, which is our immune system. It delivers that same message and say, you see this car that I just rode in, it has a specific hood on it. If you see that hood on them, that's bad. So what happens is it sends the same message out, and now our security surrounds the gate again, which are the antibodies, and it then the message is out. So next time that car comes with that hood on it, security acts, and that decreases the activity. Now, nothing is 100%, which I assume we're going to discuss. But to get back to your original question, if you ask, does it change your day? No. Why? Because I just told you that the COVID vaccine is an RNA virus. So in order to act on it and have a vaccine for it, we need to have an RNA vaccine. Now, RNA cannot have an effect on DNA. It's kind of like having a key. A key for one car doesn't work for another car. So that's why it has nothing to do with your DNA. It will touch your DNA and it will not change your DNA.
Well, thank you. That was, I love your analogy because that is very easy to understand. And so again, I mean, you're a great bedside manner, if I may say so myself.
A lot of times it's easy to attach your identity to something you do or somewhere you work because you don't like who you are.
In regards to getting to know who you are, one piece that people have to really be ready to is look at themselves honestly. A lot of times we want to sell ourselves an idea of ourselves rather than who we really are.
Hey Bobo, do trees tell each other stories?
I'm sorry, I'm afraid I don't know that.
Hey, why don't we go find out? Listen.
Do clouds take naps?
I couldn't tell you.
Dad, do stars visit their friends?
Look!
I work in the #1 cable news network in the #1 market in the nation, and I'm the only full-time African-American woman in my newsroom. Being inspired is really saying that at the end of the day, no matter what's happening in my world or around me, it's bigger than me.
There's some other questions that people often have about the vaccine.
So I'll take the question that Jean was prepared to ask as it relates to the side effects for COVID, the vaccine itself. Many people are hesitant because they say they've got these side effects. Can you talk a little bit about the common side effects and how we can overcome those as it relates to the vaccine?
Yes. As with anything, whenever you introduce something to your body, the risk of side effects. And the side effects of the COVID vaccine are no different than side effects of any other vaccines, be it the flu vaccine, mumps and measles, whatever vaccine you get shot. Most common, of course, is pain, swelling, and redness at the site of action. That's the most common side effect. Another side effect you would is possibly an allergic reaction. And with that allergic reaction, you may get lip, tongue swelling, throat swelling, which would cause difficulty breathing, which is more severe form of it. You may get hives or itching or a rash. Those are all possible, not likely, but they are possible. And you may also get some body aches, fever and chills, and a little nausea. Now, I know all that sounds bad, but when you look at the grand scheme of things, the benefit of taking the vaccine still outweighs the side effects. And most of these side effects may last for a day or two, and then they subside. And most of the time, if you do get into those symptoms, you will take something for it, ibuprofen or Tylenol, something like that. Now, I would say, as far as the allergic reaction goes, you may wonder, well, how do you know if you're allergic? Well, you can't find out if you're allergic unless you take the shot. And even if you do take the first dose and you break out with an allergy and you can't take the second dose, you will still be covered maybe 50 to 60%. So I implore and I recommend that everyone should consider taking the shot and not worry about the side effects, but worry about the main side effect if you don't take the shot, which could ultimately lead to death.
Interesting. Interesting. That is very, very, very interesting that you would say that. Jean,
Yes, I
there
went
is a
out for a while.
question.
I'm sorry.
No, that's okay.
Yes.
You know, we are glad that. So, would you pick up that third question that we were going to talk to about
Dr.
to the
Jace.
doctor?
Yes, I was going to ask him, perhaps, is there anyone that you would suggest that should not take the vaccine at all?
Yes, there are certain populations that have not enough research or study and have not been done to warrant taking the vaccine. And that main population is kids under the age of 12. Within the last weeks or so, we just found out 16-year-olds are eligible for the vaccine. They've gotten good results as far as the research. Prior to that, only 16-year-olds and up were able to take the vaccine. So now we have that population, which is the children population. Everybody under 12 is not authorized to take it, as well as those who have the allergic reactions. And usually if you found out that you're allergic, you had to have taken the first shot. So that means you still have some form of coverage from that first shot. So people who are allergic and individuals under the age of 12 are the two populations that is not recommended to take at this moment. They're actually researching and studying the 12 and under group, but they haven't come back with enough results yet.
Okay. Well, thank you, doctor. First there was the fear of going out because of catching COVID. And then we've had the vaccination. People have been getting vaccinated. And now the CDC says it's okay for vaccinated people to get together and not wear masks. And of course, again, there's still some hesitancy. So I think the question becomes, what are the chances of people who have been vaccinated of them getting COVID? I mean, as you did say, nothing is 100%. And we're not putting on, no percentages, but again, now people say, oh, now we're going too fast. First it was, so now you got this on the other side of the spectrum. So what are the chances of a person who's been vaccinated getting COVID from the studies that you are aware of?
Right, good question. And I too was surprised that the CDC amended as quickly as they did that, once you're vaccinated, you can go without your mask and stuff. And I'll explain to you my reason. You said you didn't want to put percentages on it, but I'm gonna put them on.
Okay, I didn't want to put you on the spot. That's why I said that.
It has been shown that, and these are in the neighborhood, these are not absolute numbers, but in the neighborhood of 95% effective in preventing the COVID-19 and preventing acquiring COVID-19. That's Pfizer. Moderna, I believe, is like 94%. So you're splitting hairs. The Johnson, which is one shot, which is the viral vector, has been shown to be a little less successful, maybe in the 60 to 65% range, which is still better than nothing. Okay, so if a vaccine is 95% effective, then that means there's about a 5% chance that you can still catch it. And results, and they have shown that people who have been fully vaccinated have still been able to get the now here's the caveat. Those individuals who did get the virus after being fully vaccinated, the virus was reduced to nothing more than a common cold. So the symptoms are much less severe. So far to date, as far as I know, they've been 100 of individuals not having to be admitted to the hospital. And there've been no deaths that we know of that has been attributed to COVID in people as a result of being reinfected. So, and that's the main reason for the vaccine. We can't 100% eradicate it, but what we can do is reduce it to its lowest terms and render it harmless, so to speak, as compared to what it is at its full strength. So, that being said, there is a chance of getting the virus if you're vaccinated. Going back to going without your mask now, if you're fully vaccinated and you still have that chance of getting the virus, that virus may be asymptomatic. You might not know it. But what can happen is you can still spread it to someone who's not vaccinated.
Yeah.
So someone else appear to be in contact with you can get severely ill if they're not vaccinated from that same virus that you had, even though you didn't feel that you weren't severely affected because you had the vaccine. So I don't know if you heard the term herd immunity. Yes. Apparently they've been discussing that, and what that says is they want about 75% of the population to be vaccinated, right, or to have antibodies developed to fight off the virus. Then the spread of the virus would be kind of rendered, ineffective, anomial compared to the numbers that it has now. I recall, I think the United States, there was a report out last week that said 50% of the adults in the United States were fully vaccinated. That's still not 75%, and that's only adults. So we have to take in consideration the younger population, the 12 to 16-year-olds. So maybe the next time they come out with the study, hopefully that'll push the needle closer to 75% of the overall population being vaccinated. And that number is the number that's targeting for us to return back to completely normal lifestyle as we knew it prior to pandemic erupting.
Well, thank you for breaking that down, because that's so important for people to understand the numbers and what they mean, and the fact that, at the end of the day, it won't be fatal. I think that's sort of the amazing thing I took away from it. You may get it, but it won't be fatal. And the other thing that this whole thing has been about selfishness and being unselfish. And people who in my estimation, are people who will not wear a mask are being selfish, because they're not thinking about their fellow man, because, as you said, the possibilities of spreading.
How do we know when we're listening to someone who's an idiot juxtaposed to someone who has actually done the stuff they're teaching?
You definitely have a lot of people out there who are talking and talking and talking. So you can double check their work. And if you're saying that they are saying like the sky is blue, all these other things are saying the sky is red, all right, you might need to start to follow somebody else, most likely. So you can Google what is a stock, what is a REIT, what are some good stocks to invest in, what's an index fund, so on and so on. I always think that's the best place to start.
This is the story of a boy who is very sensitive to lights and sounds. So he built secret hiding places where nothing could get in. The boy didn't like looking people in the eye. It made him feel uncomfortable. One day, he found out he had something called autism. His family got him help, and slowly, he learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
I want you to talk to us about what your experience is like as a millennial in the entertainment industry.
I would honestly say that my gender probably played more of a factor than my age did. She's a female, so she probably don't really know, or she probably can't really, and so then they would just write me off. But we got that together.
I know Gene wanted to ask you a question along these same lines. So Gene, what was your question for Doc at this point?
That's okay. I'll go ahead then and pick up the question. So Doc, after you talked about 50% of American adults are vaccinated, how long do you think it will take for us to have all people, or at least to reach the 75% of the population being vaccinated? You have an estimate of that?
Well, I wouldn't at this point. I wouldn't try to estimate, because I think that's the great unknown. That's the reason we're having this conversation, is to try and implore people to get the vaccine. There's no way of telling. We discussed earlier, there's just a certain number of people who will not and will refuse to get the vaccine, regardless of how much education they have on it. No matter what you do, whatever incentives we put out, because I'm not sure if you noticed, they've been having incentives in certain states where they're giving lottery tickets, and they're giving away free meals, they're giving away groceries, all kind of things to incentivize people to come and get their vaccine. And there's just no way of knowing, as far as I know, how many people will comply with it. I think they can do is just continue to try to track it and to hopefully get the numbers up. But as far as predicting the numbers, I wish I knew that. If I leave out right after this show and go buy me a lottery tickets.
A lottery ticket.
And buy two, one for me.
Buy two, one for you. So Dr. Chase,
That's
on that
right.
note, in India, you have people wanting the vaccine because people are dying. And yet in the United States, we have it available, whether it's walking to the neighborhood health professional. I mean, we're doing them at the stadium. We're having people be awarded. So do we feel this hesitancy is going to change at all? In terms of people.
We can only. I'm sorry.
Go ahead.
I was saying we can only hope that this hesitancy changes, and we feel that we can do what we're doing, starting from the ground. Do a lot of groundwork, grassroots. Having these vaccination drives. Like I said, some places are incentivizing it. But interestingly enough, you mentioned India. Believe it or not, the United States is sending X amount of millions of vials of vaccine over there. And it's kind of interesting how we always help. And don't get me wrong, there's nothing wrong with helping. We're supposed to help our fellow man, our brothers. But we tend to neglect home sometimes, and when we're helping abroad. I still think there's a lot of work that needs to be done here at home as far as getting these vaccines out, especially to underserved areas and to the undereducated. And when I say undereducated, I don't mean someone with a lot of letter name. So, I mean, it's just knowing, getting that info out, which is what we're trying to accomplish today. And I hope we put out some good information and will open some eyes as a result of this program.
Yes.
So true. So true. That's what we're trying to do. Gene?
Yes,
are we
Dr.
back on
Jace.
track?
Yes, I believe so. As a medical provider, how has COVID changed how you deliver services in this season? If so, how? As you deliver your
Actually,
service,
not just me. Not just me, it's affected everyone in their field. And the main thing has been the restrictions they've done, not wanting to be in contact with each other. Even though it's been in existence for some years now, the advent of telemedicine has really taken off. So with technology, for example, we're sitting here having a virtual meeting. Telemedicine is the main effect that has advanced as a result of the COVID vaccine. But I want to warn that the medical community, we have to watch omitting other major health issues and focusing so much on COVID. COVID just happens to be an issue at the moment, but we still need to address, especially in our community, the African community, the Latino community, we still need to address heart disease. We still need to address the high blood pressure. We still need to address the diabetes, the breast cancer. We need the lung cancer, all of that. And the thing is, the effect of COVID has somewhat put those things on the back burner, and people with those issues have found themselves not being neglected, but less to those issues from the healthcare community, because the healthcare community has been so overstressed delivering care to the COVID population. So that's another advantage. We're trying to get these vaccines out so people less sick, so they're back to addressing the other health issues that plague this country as well as our community.
All right.
Yeah,
Thank you.
You're
for
so
that.
right
Very
about
good.
that.
Yes.
Is a great question, Gene, and a terrific answer, because you're right. The focus has been so laser on one area, but all the other things that can make us high risk for COVID in the beginning have been neglected. You know what? Let's step away from the professional side and let's look at the human side of your profession. How are you and doctors and people in your field? How are you doing personally? How are you coping this? Because there's been so much put on you guys to deal this. I know people who work in like 24-hour shifts and days on end. How are you guys providing support for each other? And how are you guys doing just as human beings going through this process?
Yeah, that's a good question. Now, me personally, my wife has actually been on the front lines more than I have. My wife's an RN, a registered nurse, by the way. And she works at University Hospital in New Orleans. So she is more and sees it more frontline than I do, because I'm in I consult. So, but as far as the same effects it has on everyone, humanistically wise, the social distancing. I believe we haven't been out to a restaurant in I think last week for the first time in, I don't know, maybe a year. We had been, ordering takeout and get our food. For the most part, we stay home. We don't go to any gatherings, which is okay for me because I'm a homebody anyway, so it wasn't that much of a difference. But I can understand individuals get out and like to do things. The effect that it can have on, and that's a big part of this post-traumatic stress disorder going on with the COVID. A lot of people are suffering mentally because of the results of the pandemic, and something else that the medical community needs to stress and be mind of is the mental health of everyone, including especially including our African American and Latino communities, because it's so hard with COVID. Count on
You know,
hand,
Doc,
I can count on hand about 5, 6 people that I was really close to that I've lost in the last year. Luckily, I haven't lost any family members, but the friends that I have been like family. So it's, you know, and some people have lost multiple family members. So yeah, and that doesn't matter if you're a healthcare worker or not. So it's definitely something that shouldn't be taken lightly.
well, you know, Doc, again, this seems like the time just flies by. But I want to just thank you for taking the time, or for spending this time with us and our audience and sharing this information about COVID and what is helping us to try to debunk some of the myths about the vaccination, knowing that we have a community that is at the most high risk and really need to go and find out and learn and take the vaccinations because it could save our lives. You know, you were a consultant, so send our thanks to your wife and all the other frontline workers who've been out there during this pandemic. And we just want to thank you so much for taking the time to share this information. It's invaluable. Those of you, if you want to learn more about this, you can go and see. If you missed part 1, you can go to Hope TV and find out what you missed in part 2. But again, on behalf of Gene Hendricks and Dr. Sharon Mitchell and our guest, Dr. Jace, I'm David C. Linton. I want to thank you so much for being a part of this program, the program that celebrates life for those of us who are over 50. And we believe that life ain't nothing but a number, and you are forever young. So on behalf of Dr. E. Dewey Smith and our Hope TV team, we bid you adieu until the next time. God bless. And remember, you are forever young. Goodbye.
Can I just add one thing before we leave? I like to tell my patients this time, prayer is the best medicine, but God is the best doctor. Thank you.
That's right.
All right.
Amen.
All right. With that, we'll see you next time. God bless.
God bless.